Hello, my name's Colette Scully and I'm one of the respiratory nurses from Airedale Hospital. Today I've been asked to talk to you about exacerbations of your COPD. This can also be known as a flare-up or a chest infection, and it's usually identified by 2 or 3 worsening of your day-to-day symptoms. So that could be worsening of breathlessness or a cough, and it usually lasts for more than a day. It's not unusual for a person with COPD to have a one-off bad day, but if you've got have more symptoms over a couple of days, that's when we suggest that you need to contact your GP or health professional, because it might be that you're having an exacerbation. An exacerbation can be with an infection that might require antibiotics, but it can also be without an infection and you may just require the steroids. What's really important is that you know what your normal day-to-day symptoms are. So if you normally have a little bit of a cough, what time of day do you normally cough? How often are you coughing? When you do cough something up, is it regular? Is it just in the morning? What colour is it? Try and really get to know what's normal for you, so that means that you'll be able to identify when things are not normal. And also with your breathlessness, it's trying to know what you can normally achieve on a day-to-day basis. So for example, getting washed and dressed, making a cup of tea. Do these things normally make you breathless? If they don't, and you do develop breathlessness and it lasts for a couple of days, this might be a sign that you're having a flare-up. There are a few things that can trigger an exacerbation. Some examples are if you've got a cold or flu-like symptoms, smoky environments, so this could be around barbecue season, or if somebody is smoking either a normal cigarette or an e-cigarette within your vicinity. Sometimes people might be triggered by a high pollen count or high pollution. A bacterial infection like a chest infection, that might trigger an exacerbation in your chest as well. A change in environment, so it could be that with regards to the weather, the extreme heat or the extreme cold, or if you're doing any jobs at home like decorating with the quite strong odours of paint. These are the kind of things that can sometimes trigger an exacerbation. So what can you do? Well, first of all, we suggest that you always take your preventer inhaler that's prescribed by your GP. So this might be once a day or twice a day. Just check the box to make sure that you're taking it the correct amount of times. Having that in your airways will help as a protection. Avoiding the triggers, so the triggers that I've just mentioned previously, if you know that they might aggravate your chest or your breathing, then try and avoid the triggers where possible. You should always try and have a flu vaccination every year. This will help as a protection against developing flu in the winter season. Making sure that you keep your house warm in the winter will avoid bronchospasm or a trigger in your airways if the environment's too cold in your house. And if any family members have got colds and they're wanting to visit, then it might be worth just asking them to wait until the cold has gone, so that you're less likely to be infected with a cold as well, which might end up with a flare-up. So the treatment for a flare-up is antibiotics and steroids, but not necessarily both. So some of you may have a rescue pack at home with these in. So if you develop more breathlessness over a couple of days, that means that you will need to take the steroids, because that will help to reduce the inflammation. If you develop a cough that's not normal for you and the colour and amount of phlegm changes, then that's when you might need to take the antibiotics. If you develop breathlessness and an increased cough over a couple of days, that's when you might need to take both. If you don't have a rescue pack at home, you should contact your GP as soon as possible. Don't delay, because this delay could end up meaning that there'll be extra damage to the airways, and also treatment delay might mean that your recovery will take longer. If after taking the treatment for about 3 days you don't feel that you're having much in the way of improvement, then it's worth contacting your GP. It may be that they need to review what treatment you're on, and it may be that they might have to make some changes to the antibiotics, for example. If you've used your rescue pack, then I would always contact the GP to let them know that you're taking it, so that they can make sure that the treatment is working, and also so they can replace the rescue pack for future use as well. It may be that during this time of having an exacerbation, you might need to use your blue inhaler more. If you usually don't take it at all, then I would start taking it for a few days until the treatment kicks in. Or alternatively, if you take it a few times a day anyway, I would increase that just until the treatment is effective with the antibiotics and steroids, and then reduce back down until to what is normal for you. Okay, thank you for listening. Bye.